Okay, let's talk about anxiety medications. It can feel, well, super overwhelming, right? There are so many different names, so many different types. How do they even work? In this explainer, we're going to clear up all that confusion and take a guided tour through the most common options out there.
So this is the big one, isn't it? It's often the very first question on people's minds. And while the real answer is always going to be personal, something you figure out with your doctor, just understanding what the options even are is a huge first step toward having that smart, informed conversation.
All right, so when a doctor is thinking about medication for something like generalized anxiety disorder, they don't just pick one at random. They have a go-to starting point. These are what we call first-line treatments, basically the ones that science has shown are the most effective and easiest to tolerate for most people.
So, at the top of that list are SSRIs. How do they actually work? Well, think of serotonin as this little mood-regulating messenger in your brain. SSRIs act like a gatekeeper, and they stop that serotonin from being reabsorbed too quickly. This leaves more of it available to do its job. So it's not about adding some foreign chemical, it's really about helping your brain use the serotonin it already has more efficiently.
You've probably heard some of these names before. Prozac, Zoloft, they're pretty common. They're all SSRIs and they all work in a similar way, but there are subtle differences. A doctor will help choose a specific one based on a person's unique symptoms and overall health.
Next up, you've got the close cousins of SSRIs, the SNRIs. They sound almost identical, I know, but the key difference is right there in the name. While SSRIs focus only on serotonin, SNRIs work on both serotonin and another messenger called norepinephrine, which is involved in things like alertness and energy. This dual action makes them another fantastic first-line option, and sometimes they can even help with certain types of chronic pain.
Now, this timeline is maybe one of the most important things to understand. These medications are not a quick fix. It's not like taking an aspirin for a headache. It's a gradual process. You might start to notice small changes within a couple of weeks, but it can often take 6 weeks or even longer to really feel the full intended benefit. And treatment isn't necessarily forever either. A typical course for anxiety often lasts about 6 to 12 months.
So what happens if those first-line treatments just aren't the right fit for someone? Well, that's okay, because there are other routes to explore. These medications work differently and are often brought in when other options haven't provided the relief someone is looking for.
Let's start with a class of drugs you've almost certainly heard of, benzodiazepines. Their whole deal, their main claim to fame, is speed. They are designed to bring very fast, short-term relief from really acute symptoms of anxiety, like during a panic attack.
And when we say fast, we mean fast. After you take one, it gets to work very quickly, hitting its peak power in your system within just an hour or two. That's what allows it to so effectively calm down those intense physical feelings of anxiety, like your muscles tensing up or your heart racing.
And this leads us to a really critical question. If they work so well and so quickly, why aren't they the go-to solution for everyone all the time? Well, the answer comes down to some pretty significant risks. And the risks here are serious. There's a high potential for physical dependence, which is where your body actually gets used to the drug and starts to need it just to feel normal. Over time, they can also stop working as well, and trying to stop them can lead to some really severe withdrawal symptoms. This is exactly why doctors are so cautious and usually only prescribe them for very short-term specific situations.
This chart gives us a great snapshot of some of the other players in the game. You've got TCAs, which are an older class of antidepressant. Then there are beta-blockers, which are fascinating. They don't really target the anxiety in your brain, they target the physical symptoms in your body, like a racing heart. That makes them useful for situational things like a fear of public speaking. And finally, there's Buspirone, which works more slowly but has a much lower risk of dependency than the benzodiazepines.
Of course, we can't have a real conversation about medication without talking about side effects. And look, the point here isn't to scare you. It's all about being informed. Knowing what might happen helps you and your doctor work together to make the best possible decision. As you can see, the side effects can be pretty different depending on the type of drug. For the most common ones, SSRIs and SNRIs, you might deal with things like nausea or sleep issues at the very beginning. But here's the good news. For many people, these initial side effects tend to fade away or go away completely after a few weeks as their body adjusts. Okay, now we need to pause and talk about something really important. This is what's known as a black box warning from the FDA. It's the most serious warning they issue.
It means that for people under the age of 25, there is a risk that starting antidepressants can be linked to an increase in suicidal thoughts. This is precisely why it is absolutely essential to be closely monitored by a doctor, especially when you're just starting treatment.
It's so easy to get hyper-focused on the medication itself, isn't it? The pill in the bottle. But to truly understand effective anxiety management, we have to pull the camera way back and look at the whole landscape.
And this right here, this might be the single most important takeaway of this whole discussion. Medication can be a powerful, even life-changing tool, but it is just one tool in a much, much larger toolkit for mental wellness. And this chart shows you exactly what that complete toolkit looks like. See? Medication can be one important piece of the pie, but it's supported by all these other powerful strategies. Therapy, like CBT, the absolute fundamentals of lifestyle, like exercise and sleep, and active self-care. The very best results almost always come from a combination of these working together.
And here are some of those other powerful tools in a little more detail. We're talking about strategies with real evidence behind them. Cognitive behavioral therapy, which helps you reframe your anxious thoughts, the proven mood-boosting power of regular exercise, and even simple, accessible things like mindfulness or structured breathing, or even just spending some quality time with a pet.
So, after all that, we end up right back where we started, with the question. But hopefully, you now feel a little more equipped and a little more confident to go find the answer. Because the right first step isn't about picking a drug from a list. It's about starting a conversation, an informed, confident conversation with a healthcare professional, so you can build a plan that's made just for you.